So this is the thing with these tools that we'll be getting at today is applying them is a skill in and of itself outside of being able to use them and understanding them. And the important thing is, one, knowing your clinical context. And that's also workflow context too, is not everyone's going to be seeing patients all the time. What information do you need to get? Why is it important? And are you effectively grabbing it? Is the first question you should be asking yourself. And taking a look, and these things are quick. You can print them out, put them on a clipboard, and hand them to someone. What I would recommend is taking a look at it with your institution when appropriate to see if there are things you could add to collect that could be helpful. And these can be helpful not just for adding to the medical record and to filling in information that might be program specific, but also just the question has an impact other than just collecting the information, and that people really feel listened to if you're doing these appropriately. If you do a prepare screen well, you make good eye contact and you connect with someone, it gives you something to jump with. It gives you a connection. It gives you a shared understanding of the patient's past that you can really use to bring a conversation forward, not necessarily just in a clinical sense. In a clinical sense, it's very helpful for doing that because you can relate what you know about the patient now to some follow-up questions. And you can also relate it to networking the care or something or so forth. But if you're collecting information or if you're compiling reports or you're performing evaluations, that's important as well. Because if you're talking to a person, you may need to be able to forward the conversation to increase your understanding of whatever you may be doing. So going forward, Prepare is a good tool because it's easily adaptable. That's how I feel about it. So the main sections look at risks, experiences, patient assets, and aspects of the patient identity that are pretty wide ranging with where it'll be important. So you may find yourself either adding or pulling things out. With regards to culture, they don't ask about culture. So this is a cultural assessment tool by adaptation. There are few tools, and by that I mean I haven't yet seen one, and there might be one out there that is either hiding or in production that asks about culture appropriately separately from demographics. Typically demographics, like the ones collected by the U.S. Census, the ones we're taking, because those are the ones that are relevant to the medical system for accounting purposes. For clinical purposes, knowing about culture is important, and not many tools integrate it in effectively or are standalones that can really effectively be used in many different situations. So this is why I like this one. And I recommend pulling in questions about patient culture into their personal characteristics. Specifically, the first couple of questions, and you can see them here, they ask, are you Hispanic and Latino and your race? From a non-logistical perspective, I hate questions like this. I think they're bad questions. I think they're bad categories for humans. And it makes me a little bit angry every time I see it. But we all have real jobs at real places that need to follow real rules set by the institutions and bodies that govern us. And so this information it's not a requirement if we collect it or not. We need to. So the question is, how are you collecting it? And are you contextualizing it appropriately? On that, when I'm asking about someone's race or ethnicity, I don't do the closed-ended questions because I think they force people into boxes. It's been my experience and the experience of many of my patients that that's an uncomfortable process, so I try to avoid it. What I ask them is, for the first and second questions, would be, how do you define your race and ethnicity? Sometimes people aren't comfortable answering that question, so it stays blank. Most of the time they do. And if I need to put them in a category, I will, for paperwork purposes, I will ask follow-ups. So I'm basing it on not just my judgment, but what this person's actually saying. And additionally, great way to bridge the conversation forward. I will then ask a second question on how do you define your cultural identity? Sometimes I'll get a confused stare. Sometimes I'll get a very lengthy answer. but I'll bring that back to a final one. Is there any way I can integrate that into your care or whatever service you are providing? So that's 3. 1, how do you define your race and ethnicity? Race or ethnicity. 2, how would you define your cultural identity? And 3, is there any way that these are relevant to your treatment, or is there any way I can integrate this into your treatment? If you ask those questions, it's a really good way to start a questionnaire, because you're starting by essentially communicating that these things are important and that you're communicating them responsibly. I've found it really helps to create a good relationship with the patient very quickly. When you're in those clinical situations, or you're working in behavioral health, managing people in behavioral health, we're forced to make relationships very quickly with people and to get their buy-in very quickly. And making alterations like this, it's not just an information gathering exercise, although that's an important aspect. Helping you to build and solidify rapport with your patient should be integrated to everything you do. And that's a good way of putting it right there. Anyway, moving on. Assessment tools, how they make these things, right? Assessment tools are in the things that I used as a physician in internal medicine. They were based on meta-analyses. Put things in and find out what your cardiovascular risk score is, for example. These things are studied beforehand, and something is created in an algorithm in a paper based on the studied findings. When you're dealing with things that are used in behavioral health, it's very difficult to design things that way. There are few behavioral health conditions or concerns that can be measured and evaluated in a way that would be used in internal medicine. Because of that, the tools are a little softer in terms of scientific validity. They're just not as much evidence, but for what we can measure, the evidence is good. I'd encourage you, when you're going to use a tool, make sure it's been evaluated scientifically. Make sure there is a paper citation, a citation of a scientific paper going into a scientific journal that you use. Anyway, for those of you who it's practical to look into, if your institution uses something, use it. So these are based on meta-analyses or verified in clinical testing. The tools are often designed with evaluation in mind, though. And by that, I mean evaluation of the tool. And because of that, sometimes they're not really practical to integrate into practice. So that's a thing. And just so I'm like getting the room right here, please raise your hand if you've found in the past that any sort of screening tool is not practical for the application you're using it. Hands, any hands?
So we've been having a hand up from Ana Maldonado. Did you wanted to share anything earlier? No? Okay.
No, I apologize. I just took it down. I saw that. Sorry.
Okay. No problem.
So I'm going to assume that most of us have been frustrated with screening tools before, and move on. So when using this tool for assessment, I would recommend adapting it to the realities of your clinical practice. And some of those tidbits, like how to change how you're talking about race and culture, are adaptations you can do pretty uniformly, but there will be aspects of your clinical practice where you need to change your questioning. I recommend you doing that, but within the context of your facility guidelines and practice. In order to integrate assessment for culture into the prepare tool, use it as the third question, as I suggested. It's a quick way to do it, and it's a great way to get that information effectively. I'm going to pull the tool up right now, and I'm going to do a quick interview. So, you good to go?
Yeah.
Okay, so folks, we are going to do a quick case here. So I'm going to be a behavioral health worker, and the FIDE is going to be this patient. So just to quickly read the case, a 30-year-old female presents to the ED with complaints of chest pain and difficulty breathing. The patient feels diaphoretic, they're pale, and startled upon examination, when people are kind of on the edge of their seat. She undergoes a complete medical assessment, including physical exam and laboratory screenings, all the important stuff for this condition: CBC, Chem 12, drug screen, trope, all are normal, aside from some minor anemia. She has no medical issues. The care team discloses that the patient's a graduate student and has an upcoming exam, and they are concerned that she may be experiencing some psychological sequelae of that stress. Because of that, they send me in to evaluate her and to network her to care. Anyway, so we are going to take portions of this, and we're going to start by Fide, you're in your exam room.
I have been experiencing a lot of chest pain lately.
I'm not in yet.
Okay.
I'm not a doctor, by the way. I'm a behavioral health worker. So, knock, knock. Let me in. I'm coming in.
Yeah, I can come in.
Was looking for a funny transition there, but it didn't work out great. So Fide and I have just gone through an initial assessment, and I told her I want to do this tool. So Fide, like I said, we're collecting important information on all of our patients about sort of their backgrounds, and I have a screening tool, like I told you, that has some questions that'll help us better network you to whatever services that you need. So we're just going to go to the questions. I'm going to ask the questions as they are, with a little bit of some minor changes. So how would you describe your race or ethnic background?
Well, I am from Honduras, so I consider myself being Hispanic.
And is that how you would define your cultural background? How would you define your cultural background?
Well, I speak Spanish. That is my first language. I grew up in a Christian family. What else? Music is there's a lot of involvement with music in my whole family. So I grew up dancing and playing instruments and all that kind of stuff. Yeah.
Thank you for that. I always ask my patients, is there any way that your race, ethnicity, cultural background should be integrated into whatever we do? And if it's not, that's fine. Some people do have things though that they mention. Is there anything?
Can you repeat that question again?
Is there any way that your cultural background should be integrated into your clinical care? Just a yes or no. And if it's yes, what is?
No.
Okay, cool. So at any point in the last 2 years, has migrant farm work been your family's main source of income?
No.
Have you been discharged from the armed forces of the United States?
No.
Get a dog barking. Excuse me. What language are you most comfortable speaking?
It depends on the situation. Sometimes in Spanish, sometimes in English.
Hold on, I have a child. Excuse me. Alrighty. English is fine in this context, then?
Yeah.
Fine. Okay. How many people do you currently live with?
6 people in my house right now.
Okay. All right. And what is your housing situation? Do you have housing, not have housing, or you don't need to answer if you don't want to, by the way?
I would say I do have a permanent place where I sleep every night. So yeah.
Are you worried about losing it?
Yes, sometimes because of my income, it's hard for me to make ends meet sometimes, especially trying to pay rent and my food.
Okay, sorry about that. Um, uh, Formal education. How far did you go? High school, college, more, less?
I was able to complete college, and I am currently going in grad school. So I think that's part of the reason why I have been struggling with trying to make my payments, my
Mm,
rent payments, and yeah.
sorry to hear that. It sounds like a lot. And your current work situation?
I currently work part-time.
Okay. What is your main insurance for medical care?
I don't have insurance.
Oh, okay. And hard question to answer, but any idea what the total income of the household is um, every year?
I have no idea.
Okay. Okay. Thank you very much. Okay. Now I'm going to readdress the issues that I pulled out. I got some important key information here. I got where she was from. I got her identity as she defines it. And we're going to say in this clinical situation that it's been difficult to network this patient to care. There's some resistance. So I'm going to follow up by asking her some more questions about her cultural background and how that might impact it. So Fide, thanks for answering the questionnaire. So we discussed earlier about the incident here, and that your doctor thought it would be great to access some behavioral health, some therapy, perhaps medication as well. You were a little resistant from what he told me, and I was hoping we could have a more of a conversation about that. How do you feel about that?
That's okay.
Cool. Um, so before I ask you some questions, is there anything specific that you just don't like about that idea, or is there something you'd like to share?
Yeah, about the medication therapy, I have never heard about that before. Um, I don't know. I don't know how that would work.
Okay. Um, so we can go over it if you'd like. Okay.
Okay.
So I noticed when you were telling me about some of your details here that you mentioned that you came to the States when you were younger.
Yes.
Okay. So have you ever been exposed to or seen a therapist or no?
Mm-mm.
Okay. How about at home? Has anyone ever used one, or has mom or dad mentioned therapy in their lives at all?
No, therapy is not even a word in our house.
Interesting. Why is that?
I don't know. We just never really had, how can I explain it? We never really had that situation where, like, I guess if we had like a tough situation that we were going as a family, we just pray.
Hmm.
That would be like the number one advice. Like I mentioned earlier, I grew up in a Christian family, so that would be like um, the first way to seek for help.
Hmm. Hmm. So behavioral health and mental health is pretty complicated stuff, Fide. Uh, and what a lot of people find helpful is using different sources at the same time to help themselves.
Mhm.
Uh, so I think therapy and networking into care would be a great addition to that. Um, uh, so anyway, so you mentioned that you came to the States when you were relatively young, and you were experiencing some financial issues as well with school and so forth.
Yes.
Has that impacted why you came in today and why?
I think so because I have been getting stressed out. I have been feeling anxiety, something in my heart has been feeling like it's gonna come out of my chest sometimes.
Okay.
I've been feeling jittery. And I think a lot of it has to do with like all the deadlines I need to meet for school and also trying to keep up with my part-time job. All of this is new to me because I'm also like the first to go to college in my family. So I'm trying to really complete this.
Mhm. You're a trailblazer then. It can be
Mhm.
difficult.
Yeah.
It can be difficult. Um, Thank you. I was looking at what you told me here. So, Fide, do you think any of those issues have been a barrier for you for wanting to give this a try?
Wanting to give
Perhaps,
therapy.
and this that no one has mentioned it at home.
No, I think that now that I know about it, I would be willing to try something different. If
Okay,
it will
so
help me.
I have a colleague. Have you ever been? Do you have? How old did you say when you came here?
12
12.
years old.
I have a colleague from El Salvador who happens to be a fabulous primary care physician that
Oh, nice. Okay.
you guys may have some things in common.
Mhm.
I know he goes back often. How do you feel about that?
Yeah, that sounds good.
Awesome.
Yeah.
And scene. So adaptation, it works. It bridges to what you need to do moving forward. Next slide. You have anything to share, Fide?
No, that's it. Thank you.
Mm. Uh, Okay. Next question, please.
So,
So I was hoping that we could use the remainder of the class to go through a couple of discussion questions that will take some time to talk through and to understand. I'd like to do them one at a time. And the first one, we'll do our same system as usual, Fide.
okay, so for the first question, understanding the cultural landscape of the community where you practice is an important element of effective clinical care. What are some ways you can become more familiar with this in your daily life and in your professional life?
So let's take 4 minutes. If y'all can just take some time and just reflect on this. If you can type something or write something, I think that would be great. But we'll just take that time to think about it. You think 3 minutes is enough, Peter?
I think so. 3 minutes?
Yes, I got a timer starting, and it
Yeah.
starts.
Okay, so time is up. Do we have any volunteers that would like to participate, provide their answers? Okay, so we're gonna start choosing people. Amy Williams, would you be willing to provide a response to the first question?
Yeah, I mean, I think for me working, oh gosh, I'm trying to put my camera on, sorry. For a primary care association in Pennsylvania, which Pennsylvania, if you've been following the election, you know it's kind of a wacky place to live. So it's pretty, we have Philly and then Pittsburgh, but pretty much everything else in between. There's a lot of rural areas. So I think for me, learning how to best support our health centers who are both in an urban and rural setting, we have, you know, a very diverse population that we serve throughout the state, a huge immigration population, lots of Amish communities as well. So, I mean, just the spectrum of diversity is pretty large, and I feel like that's not really talked about. So I think just really listening when I can in community spaces and learning from the community members, learning from the providers who are really, you know, the boots on the ground providing care. And then in my daily and professional life, just staying as educated as possible, participating in trainings when I can. But I think for me, just really taking a step back and listening to people's voices who aren't heard as often and who are marginalized so that I can provide better trainings and support.
So I'm piecing it together now that you're telling me this, because I have an okay understanding of the geography of your state. Philadelphia and Pittsburgh in the middle. It's there aren't any major cities.
I mean, Harrisburg, like there's Allentown and Erie, which are also like cities. Like we have smaller cities, but I think people forget that, like, I live in the Harrisburg area, and if you drive 5 hours north, which would take you to New York, it's pretty rural. I mean, like, I mean, broadband really in a lot of places isn't accessible, which creates another issue with access to care. So yeah, it's the makeup of our state is a bit challenging. And I know other states have the same issue, but I work a lot with telehealth policy and advocacy. So I feel like I talk about the makeup of our state a lot. So yeah.
That's unique. I know the Amish population is large and growing in that area as well. There's some unique challenges to that in telehealth, I'm sure. And that's very interesting. And there's a couple of things that I took away from what you're saying is, like, I agree. I know when I came to DC, this whole area was new to me. And it turns out there are some immigrant communities that are pretty specific to this area. For example, the Ethiopian and Eritrean communities are huge. And they're not as big in other parts of the country. So it's a bit unique because Amharic is pretty widely spoken and used throughout DC. And the community is very different than other communities I serve. So the best way of learning from them was really just listening to them in the exam room. And what's cool about that is it also has a therapeutic effect because you're listening to someone who society probably doesn't listen to as much as you're going to listen to them in that exam room. And that's a shame, but it's the reality, and we can help make it a little better. So appreciate that. Really like that response. If we could get one more, that would be great, Fide. Thank you.
Thank you, Amy. Okay, do we have a response from Kayona Woods? How are you?
Good. So I basically said about the same thing for the answer. Just reaching out and doing your research, taking time to learn more about your community in general, actively attending events and other things like that in your area and in your community could also help you with familiarizing yourself with the cultural aspect and landscape of your community. There's sometimes if you just actively get involved for events going on, you can learn a lot about the people in the area.
Mhm.
So that's a good point. And like, it's also an opportunity as well. And the way I 100% agree, that's one of the ways that I would use to familiarize myself with the community and see. In a way, it's almost like participant observation in anthropology, and really, but you get to have fun doing it too, and it really can broaden your life as well. Being a better behavioral health worker is also, like, fun fact, a great way to be just a happier person too. A lot of these things are therapeutic as we learn and do them, and that's a perfect example of it. So I love it. In my area, there's a lot of different immigrant communities, and popping into festivals and popping into establishments designed and used for, like, for restaurants, for butchers and so forth, like little things like that, exposes you to more diversity in your own life, and that's fun. It also informs how you interact with people, and you may find that if you interact more with people from different cultural environments in your personal life, that you learn to understand different social cues, body language, and so forth that different communities use. And the best way to learn those things is to interact with them. I would argue that the only way to effectively interact, to learn with them, is to interact. Same is true with culture, same is true with language as well. I know I took German for 6 years. Middle school and high school. I can tell you Guten Tag and that's all, but I spent 2 months in Haiti and was speaking sentences of Haitian Creole by the end. Why? Because I was sitting with people all day. So it makes the learning process more fun and quicker. So I really appreciate that. If we could please, thank you for that. And if we could please do that last question, please, Peter.
Sure. So for the last question, a culturally inclusive workplace supports and nurtures culturally appropriate practice. How can you support this at your institution?
We will take 2 minutes. And when you're thinking about this, think institution as far as the way you interact daily throughout your workflow, and also institutional things like, meetings and committees and so forth, if it's appropriate to your context. I'm just seeing the chat now. Dr. Christie made a good point about community partners. And like, this is, I think, an important one to mention. Community partners are important for getting those deeper connections, and they do provide networks for you to be able to get that understanding and to update that understanding as you work. So I appreciate that one. Thank you.
Okay, so the time is up. If we can obtain a response from Mikia or Mikia Wall. Okay.
So I think one of the things, so we're talking about the second question, correct?
Yes, the second question. Yep.
Okay, so I think one of the things that we do is one, like working with our interns, teaching them how to be culturally competent, and to use cultural humility, sitting in on their sessions, observing, asking them, how they feel like they connected with the client as far as like rapport building, asking them like, is there some like language they can change as far as like, depending on like the client's education level or level of understanding comprehension. And then I also think just working with providers who may not have as much of an understanding as to what's going on with their clients, like more intimate, in-depth details to see how they can be of assistance. So those are the two things that I can think of.
So I appreciate that. As you were talking, I connected to my own experiences and just relating to that, a couple of things came to mind. One, institutional culture is important, and it's not something that you just learn from a PowerPoint. It's something you experience through working and your relationships with your colleagues. A lot of us are lucky / not lucky enough to be working in person very often and with our constituents. So we get to do that. And it's an important opportunity to pull people into that institutional culture and to share it and to make sure those values are echoed in their clinical practice and interactions with their patients. So I appreciate that. And to contextualize things. So I think we won't do hands for this one, but I think everyone has been in a situation where they've had a colleague, even in this field, that has views or perspectives of culture, race, gender, so forth, that we might not agree with, or that we feel may be damaging to our patients. And that can be a difficult one at times, because confronting that can lead to backlash. At times it can ruin a relationship. It can be also very stressful. And I think we've all been in that situation before. It's affected us differently based on our own backgrounds. But learning to work with and to understand folks with different backgrounds sometimes can be an important bridge to fixing some of those issues that you may see in your colleagues. I know I've seen colleagues that I felt were like that over time have adapted very quickly if they were in a supportive enough environment. That can be difficult if you find that offensive, but it's an important thing to mention. The more we pull out these behaviors that are associated with those things from our work life, the more they leave permanently. So I appreciate that. And if we could have one more, please.
Yeah, so we actually have a response via the chat from Abira Calecho. She says some Americans forget that they were descendants from immigrants, so some work should be done to educate the society. Language is a means of communication, and some have wrong perception about cultures, the way they wear, worship, and talk.
Mm. And it's a good point. And we've all, when I think of the world that my parents grew up with, and they were surrounded by people who were from the same country as them and spoke the same language and came from the same village that they came from. And the amount of diversity they needed to deal with was very minimal. And I compare that to their lives now here in the United States and how much, and it is overwhelming to them at times. As the amount of diversity you're exposed to goes up, the amount of time you need to put into understanding that goes up as well. So it's certainly time consuming. It's certainly important, and we need to do a better job at that. So I do appreciate that.
Okay. So
if we could get one more, I'd super appreciate it.
Okay, do we have a response from Jill Cowie?
Yeah, hi. Can you hear me? Okay, I was frozen. I think this is kind of a broad level response, but I think it takes courage to nurture culturally appropriate practice. There's the norming effect of the medical model that narrows the range of okay conversations. So I don't really have an answer except for to really center the courage in asking questions that might be a little different, just a couple of examples. You just doing a PHQ-9 with a Muslim woman, the question about hope was off-putting or hopelessness, because she's a deep believer and hope is, in God, and to suggest otherwise it just was a non-starter. Even it doesn't mean she doesn't have mental health issues. It was just like there's a different door to go through, or concerns. And another example would be a woman who's been here a couple of years, a young woman from Haiti. Kevin, it'd be interesting to get your response. I had spent just a couple of weeks there, but got a sense of how strong the voodoo, I don't even know, practice or understanding or wisdom or philosophy is. And to even have a conversation on her perspective on it seemed important to me. But in an integrated short-term exposure, it didn't feel like something to bring up. But at the same time, I think it was relevant to the conversation. So I struggle. I'm new to this position. So I struggle with all that. So I guess that's all I have to say right now.
You never give yourself credit when you're telling us stuff, Joe. You know that?
I never do.
So I appreciate this. I think this is an insightful bridge off point to some important points. One, interesting stuff, isn't it? The religious context in Haiti. There's a lot going on. People practice multiple religions and different branches of voodoo at the same time. It's very complex. But I'm appreciative that you're integrating your knowledge of that into your care. I think that's incredibly important. And knowing that population very well, destigmatizing, talking about that, or them feeling like they could come to someone who didn't look like them and speak honestly about it, that's a big compliment. So that and the perspective here. When you mentioned hope with the I believe it was a religious woman, a Muslim woman that you saw.
Yeah.
Recent immigrant.
Yeah, it's a PHQ question, like hopelessness, and then the one about like, do you consider harming yourself or killing yourself? And it's just felt very culturally inappropriate to be asking. I actually apologized. I said, I don't know if these questions are appropriate, and I culturally appropriate. And she said, yeah, well, you have your culture, I have mine. And so, but and I think in reflecting upon it, I wish I had another way in to ask her. I think if I had another thought about like another prompt, because it doesn't mean that she all is well in her life, right? But I needed another door. So.
And sometimes those doors aren't there, right? Sometimes those doors aren't there, and there's no screening tool or way you can articulate that that's not going to totally alienate your patient. But knowing when to stop doing that is an important skill, because you could, especially if you're talking about a religious or issue, it has the potential to offend pretty significantly, and that can be a substantial barrier to help for them accessing it. So just knowing when to stop asking the questions is good, and I think people see that. What I'm seeing here is the word hope had a different religious and cultural meaning for her than the word hope means for us. With a lot of words, the perspective on them and how we contextualize them is very important. So the fact that you identified that and addressed it, I think is important, because it's a hard thing to pick up. It's a hard. Even knowing
Excuse
that
me, I'm sorry.
a different cultural background is uncomfortable, sometimes it's hard to tell because you don't understand the body language that they use to communicate that, as well as you understand folks from your own culture. I know when I was first serving the Amharic speaking community, I struggled with that because for a lot of recent immigrants, their body language was different than mine. And I think they struggled with mine too. So these are important ways to create bridges. So I appreciate that. And yes, for the courage, because in this field, we're confronting difficult issues all day, every day. That's exhausting, and that's why not everyone's in behavioral health, because you kind of have gotta have a specific type of brain to be able to do it. So I encourage you all to continue on that journey. And thank you all for your time today. And with that, we'll be signing off. Thank you.
Thank you.
Thank you, everyone. Sorry, just before everybody leaves, this is just a reminder about our next session next week on Wednesday at 1 p.m. and to please fill out our post-evaluation survey. Thank you, everyone. Have a nice day.